TopMed Talk.
We are here at EBPOM USA 2018 Master's Course, a Perioperative Care Practicum in Atlanta, Georgia. My name is Desiree Chappell, co-host of TopMed Talk and the Roundtable. I'm joined by Monty Mythen, my co-host as well. And we have this afternoon Dr. Tim Miller. He's an anesthesiologist from Duke University. Dr. Angela Edwards, she's the head of the perioperative medicine school at Wake Forest School of Medicine. Thank you guys so much for joining us this afternoon. Angela, I'm going to start with you. Can you just give us a little bit about your background and what other roles you were playing besides there at Wake Forest?
Well, we'll start at Wake. So at home, I am actually an intraoperative anesthesiologist that works in the perioperative medicine realm. So I work both in the preoperative assessment clinic as well as postoperatively in sort of our perioperative medicine continuum of care. So there's a lot of collaboration between anesthesiologists, internal medicine physicians, and hospitalists. Outside of Wake Forest, I am the president of SPACI, the Society of Perioperative Medicine and Quality Improvement. You can go on our website, www.spaci.org, and take a look at our program, our curriculums. We host a perioperative medicine summit every year, and very similar to what we're doing here. A lot of cohesive overlap with perioperative medicine education for multidisciplinary practitioners, hospitalists, internal medicine, again, physicians, and anesthesiologists who kind of coalesce in the field of perioperative medicine. So I wear a few different hats, not as many as Monty.
I don't think anyone would. That's great. Thank you so much. I know it's interesting to see other people from other organizations saying, hey, we're talking about that too. It's good if we can maybe have this conversation together.
It is, and it's amazing what they're doing here. Hearing about how people are standing up different components of a preoperative clinic between looking at the nutrition piece, preoperative anemia, diabetes management. It definitely takes a team approach in every sector, and it's nice to hear how everyone's coming together and putting those pieces together here with the enhanced recovery piece as well.
Monty.
So, Angela, how long's the society been going for now?
Since 2006.
So it's 11, 12 years now. So a lot of the discussions are that this is just sort of happening now, but it's not really. It's been going on for a long time. So EBPOM 20 years old, your organisation 12 years old or so.
Yeah, it's an enhanced recovery, even older than that, right?
Exactly.
The SPACI started probably with the initial inception of preoperative clinics. So historically, pre-op clinics were developed through anesthesia as a pre-anesthesia type of clinic, so getting patients ready for anesthesia only. And it evolved over time when we realized we could do so much more as physicians, as clinicians, and working together. We had this, probably in about 2010, 2012, shifted towards more of a perioperative medicine global approach. So looking at the patient from a holistic perspective and trying to improve outcomes after surgery, not just from the intraoperative anesthetic management piece. And so we tended to collaborate with our ambulatory medicine colleagues in medicine, and then our intensivist colleagues afterwards. So we had more of a collaborative approach to pre-op encounter.
So I was wanting to ask kind of what you guys are feeling like the highlights of the meeting are over the last couple of days. Tim, what have been some of your favorite sessions?
I've really enjoyed the whole meeting. I mean, I don't think I can pick out a highlight. What to me has been the highlight has been the style of the meeting. I mean, we all go to a lot of meetings, but I think this meeting is a little bit different. It's a practicum. It's had a lot of interactive nature. We've obviously focused on setting up preoperative services, which is new. So it's had a different feel to any other meeting I've been to. There's been a lot of energy, a lot of engagement, and it really feels like that everyone is interested in setting up these services and is really, really learning and getting engaged and giving their energy to the meeting. So it's been great.
Yeah.
Tim, a lot of time's been given over to discussion, which is often truncated. It felt as though even more time could have been given to discussion. It's pretty much every session, even though we're 45 minutes into the discussion period, is getting stopped with people having more to say. Is it just me that feels that?
It's that age-old thing. You see an hour of discussion, and as someone chairing the session, you think, I'm going to have to try and fill that hour, and then it just goes, it just disappears. So I completely agree. You can never have too much discussion, I think, in these meetings.
Yeah, Angela.
I agree. What I love about these sessions is it feels you've got a lot of people in the room, but you've broken it down to make it feel like it's a small group session. No one's intimidated to ask questions. Your experts are in the panel. It is definitely moved to a more small group, intimate setting. So you've got your experts and you've got other collaborators right there.
Yeah, it's great, and people are just starting to get warmed up, really, as we tell them we have to stop talking, for sure. One of the things we want to do on TopMed is the same thing, be able to bring participants in and actually talk to some of the authorities as well. So, Monty, final thoughts?
Well, I just come out of a great nutrition session with Paul Wishmeyer, who we'll be talking to later on. But it's interesting, the recurring theme in there about the preoperative carbohydrate drink is how much time and energy and stress goes into the discussion of something that costs a few dollars. I'm sure this water on the table here in this hotel has cost a lot more than and I'm not trying to promote the product or anything like that at all. I'm just saying is often the things that cost very little money take a huge amount of energy in discussing it. What's going on there?
Tim, what do you think?
I agree. It's amazing how much you can debate the carbohydrate drink. And I almost just think that we need to get beyond the carbohydrate drink and thinking the bigger picture of nutrition that Paul presented. Because, within enhanced recovery, I don't think nutritional supplements beforehand or afterwards are routine within enhanced recovery. I think we need to get to the stage, like other elements of enhanced recovery, where we're getting, 80, 90, 100% compliance with giving protein and oral nutritional supplements for a week beforehand and a week afterwards, and it's a big gap, I think, and Paul's just obviously bringing a lot of energy and enthusiasm to that area.
I loved his analogy of running a marathon, and that you wouldn't starve yourself or make sure you're dehydrated before you go out and run a marathon. Any high-intense athlete is going to make sure they're properly hydrated, adequately have nutrition, and then begin. And they're going to start that weeks in advance. So why would you go into surgery with that same mindset?
One last thing. I'm sure we'll ask Paul to share it with us later, but he described his perfect personal drink. Whey and berry. Is anyone drink? I'm not going to drink that.
No. You'll have to have him describe that one later.
But it's a teachable moment, surgery. The day before surgery may be the only time I would drink it.
That's about the only time they drink a lot of that stuff anyway. So. Well, guys, thank you so much for sitting down with us at TopMed Talk. Please be sure to follow us on Twitter, LinkedIn, Instagram, all your favorite social media platforms at TopMed Talk. For daily updates and the conference live stream and discussions with speakers and participants, you can find the podcast on our website at topmedtalk.com, and please subscribe to our on your favorite podcaster app to TopMed Talk. Guys, thank you so much for joining us.
Thank you.
For the next session.
TopMed Talk.